All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So hope everybody is doing well. DDS is first today. Algebra is second. The Shri is third. James, hello. John Snyder, Rima, Svetlana, and Rima. So how is everything? Tell me what's going on. How was your weekend? How many of us here are vaccinated versus not vaccinated? Emily Wiggin says, hi Beans, I've missed you all. Welcome back, Emily. Rima says, you look great today. Thank you very much. Grabbing my chat bar. John Snyder, hello back. Almost renewed. Yes, I totally enjoyed it. Connor Bear says, I'm recently newly vaccinated. Very good. Congratulations. Rima says, double Pfizered. Congratulations. Cindy says, not vaccinated. John says, nope. Lizzie says, hello again. Hey, Lizzie, how are you? David, not. And lots of emphasis. DDS, vax here. And just, I am vaccinated with Moderna. My wife with Johnson & Johnson. My one son with Pfizer, other son with Moderna. Jana says natural immunity here, no COVID jabs. So Jana, you actually had COVID? Yes, I remember you had COVID. Hope you're doing well. Murguda says vaccinated. Congratulations. Connor says vaccinated with previous COVID infection. Neri says not vaccinated. Jody says one dose, not sure want another after petechiae. Oh, wow. Nancy says we vaccinated. Wow, there is a lot of folks who are vaccinated. Good. Kelly Holmes says natural immunity. Kelly says, I am scared of vaccine because of reaction of people close to me. My doctor can refuse to talk to me about how to plan for vaccine and prevent allergic reactions. It is actually a fair concern. But at the same time, COVID itself is a concern as well and much more dangerous than vaccine. Pasi says, Dr. Bean, look up Dr. Sunil Dhand. He looks friendly and good. I have seen some of his talks. Epilepsy and severe allergies, recovered, so not risking side effects. I've heard some of his talks. So here is, and I think cool beans who have been with me for a long time, they know this. I believe in vaccines. I used to talk about vaccines. I have vaccine. The reason I'm saying this is what I find unfair is for someone to take the vaccine and then tell others not to take it, unless they themselves have gotten some severe side effect that has made them to say, I got it, this is what happened to me, I'm not going to recommend it. But I know folks who have become vaccinated and then they just keep coming out and just give these messages not to be vaccinated. That is not right. In case of Dr. Sunil Dhand, I believe that he himself had gotten COVID before. So for me, that is also pretty good protection. So Steve Ono says, can you share your treatment protocol for vaccine injury? It's been 5 months of agony for me post-Pfizer. Ivermectin works while on it, but symptoms come back when I stop. If steroids, please dose. So I think a better approach is to talk with the IncelDX folks or Dr. Yo, because they have now a group of doctors who I believe recommend or advise Miraviroc. After looking, Miraviroc needs a lot of attention. It can cause severe side effects. So they work with the patient to figure out Miraviroc, statins, and some other medicines. Have you talked with them? They actually do a analysis of the S1 proteins as well to see if monocytes are carrying them or not. Full disclosure, I have no interest, relationship, link, association, other than Dr. Yo is my friend. Dr. Bruce Patterson has been on this channel many times talking about his researches. No financial interest, no strings attached. I just think that they're doing good work. So it may be useful to talk with them. So Neri says, so I believe that sometimes folks ask me question, which when I answer, that answer puts me up for heat. So Dr. Peter McCullough has said in a couple of interviews that one with natural immunity can't get COVID again and can't pass it to others as asymptomatic carriers. What are your thoughts on this? So folks who have been with me, they know that what is my answer here. I do not know what exactly is Peter's point of view and the mechanism he's thinking about. From a mechanism point of view and the way you articulated that somebody who has natural immunity can't get COVID again and cannot pass it on as asymptomatic carrier, this both are incorrect. But again, I do not know what did he exactly said. I am reading what you have written here, and so this is probably third-hand information. But let me explain this with a mechanism. So first part, natural immunity. So let's say here is a person. This person, stylish person. So this person had, this is how I draw people, and a smile. So let's say this person some here. Okay. This person got infected. So when they got infected, let's say in point in time, they got infected here, exposed here. Let's say it is Delta virus. It took 2-3 days for them to develop symptoms, 2 to 3 days. So this is the first time infection. They were shedding before that, which is fine. We all know that. They were at one point asymptomatically shedding, then symptomatically shedding. Then in another 5 to 14 days, during this time frame, somewhere during this, everybody is slightly different. I'm expecting this person not to have a vaccine or previous infection. During some point here, their adaptive arm will become active, correct? B cell, T cell would start working. When they would start working, the B cells would start making antibodies. T cell, some of the cytotoxic T cells would start killing the cells that are expressing antigen. So if I here made an antibody level, I would say somewhere over here, antibodies would increase. And we know that in the case of SARS-CoV-2, IgM and IgG, they both start increasing together. Normally, IgM comes in first, then it goes away. Meanwhile, IgG comes in and stays on for months. Here, IgM and IgG become available together. IgM goes down soon. IgG continues on. While the IgG is continuing, IgA will be developed as well, and that would also be available. IgA would go and protect the mucous membranes and barriers, mostly mucous membranes, GIT, mouth, nose, eyes, other wet surfaces. During this time, if the person gets another exposure, then of course we already have the surfaces, mucous membranes filled with IgAs, plus the B cells and T cells specifically in the upper respiratory, wherever infection occurred, upper respiratory tract, they're also active. So if I get exposed again, let's say I was the one who was infected, and I was in this stage, then I would not even know that I got exposed again because my body is already taking care of it. I will not shed at this time if I have taken care of my own virus. And if new virus comes in as well, I will not shed and I would not be more sick because I'm already handling it. This phase in some people continues for 2-3 months. I have read the studies and discussed them here for 90 days or more, in some people for 6 months, 8 months, and so on. So meaning this is variable. Just like the start is variable, the waning is variable as well. Once the waning has occurred, once the immune system has gone down to this stage, and anybody, of course, there are going to be folks who would say, how dare Mubin say something that is different from Peter McCullough? These are mechanisms that are present in books and research literature. You can just Google it and you can look at these mechanisms. These are not something unique that I'm talking about. So here we are. And this is why I had said, I do not know what was in Peter's own mind when he was talking about it and what was the background mechanism in his head. I don't know about that. So now let's say the person is in this stage. In this stage, most of the active cells have gone. Some memory cells have formed in the areas of infection. Some have gone and started living in the lymph nodes. Others have gone to the bone marrow and started living there. We have done all these studies in the past discussions. The antibody levels have reduced, and the body just knows that if the virus comes in, it is going to attack it again, and it has cells ready to do that. Now let's say infection appears again. Another exposure occurs. If I go back here for a second, if the exposure happened here, then Peter is correct. During this exposure, there will be no shedding more than what was already happening, and there will be no further infection. So fine, yeah, possibly no shedding and nothing. Here, when the infection occurs again, exposure occurs again, this will now depend upon a person's body habitus, their state, their body state, their strength, their immune system strength, their nutritional status, their genetic form, whatever it is. Some people will handle it very simply. So what would happen is once the virus arrives, once again, let's say in my mouth, after 5 months, my immune system is kind of dormant. It is resting. Virus appears, let's say it is Delta. Delta is a rapidly dividing virus. So I got exposed to Delta here. Now, ideally, the cells here in my oropharyngeal area, the B cells, the T cells, innate arm cells, they are mostly B cell and T cells are aware that there is a SARS-CoV-2. They can become active here. Innate arm are kind of reprogrammed. It takes them, even when there is a cell that becomes aware right away that there is an infection, that cell still needs to understand the infection has occurred. It needs to make copies of it. And cell division is not a thing that happens in seconds. It needs to become differentiated. So we say proliferation, and you can just look up these words. Proliferation and differentiation occurs. Differentiation occurs. Proliferation means increase in number of cells. Differentiation means more specific function. So proliferation and differentiation occurs. It takes anywhere from 10 hours, 24 hours, 48 hours. Everybody has a different time to respond. Now, during this time, let's take 48 hours, which is more common. This is why sometimes when you take the second dose of a vaccine, the symptoms start after a couple of days and stay on for some days after that, because the immune system woke up in 48 hours, 24 hours, and started making a lot of antibodies and throwing them out, and that causes side effects. Now, when the immune system becomes active, that is when IgG, it is possible that some IgM is made again, but mostly IgG will start becoming formed again. Some IgA will start getting formed again as well. Now, this would have to be some days or hours before the immune system can take care of the virus. It could be within 3-4 days that immune system has tackled the virus. The problem is this time, when the immune system is not still fully up and running, virus is up and running from the time it landed in our mouth or nose or eyes or wherever, and it is still dividing and causing symptoms. When a virus or a pathogen lands in us, we call it infection. When it causes enough damage that symptoms appear, we call it disease. So when the virus entered our mouth, it infected us, that is reinfection. Then it started increasing in number and causing destruction of the local tissue, and we started developing symptoms in 10-20 hours. It has to do enough destruction that we feel symptoms. Now we have symptoms. Can we say that the person would always be asymptomatic? No, because in many, the symptoms will appear. Can we say that during this time, when the immune system is not active and is not taking care of the virus yet, will the virus not be shed regardless of the symptoms? Yes, if it is in enough load, it is going to be shed as well. So vaccinated or previously infected and recovered and then reinfected, either way, it depends upon what is the immune system's state. That would dictate if the person is going to shed, how long would the person shed, and would they develop symptoms or not develop symptoms. So a blanket statement that anybody who had previous infection is not going to have symptoms and is not going to shed is, in my opinion, incorrect. It depends upon what is the state of the immune system, what is the viral load, what is the person's response. I hope it makes sense. This all can be Googled and searched and looked at. Pasi says, so just keep distancing when with vulnerable people around us. Yeah, so I think really, regardless of what is your stance on vaccines, on medicines like ivermectins or vitamins, you don't like them or you like them, physical distancing is very useful, hand washing is useful, mask wearing is useful. So there are some hygienic habits that can protect us as well. And why not to do it? Why not to protect ourselves? In whichever way you can. Is a person, I strongly believe that a person who says, I don't want a vaccine, still want to protect themselves. I don't think that they're saying, you know what, I want to die. I think they're saying maybe the vaccine is hazardous and I want to protect myself. I don't want to have a vaccine. At the same time, this is what I disagree with when people say my immune system should just be sufficient. Yes, in many cases it is sufficient, but in many cases it is not. And when it is not sufficient, or when it is more active than it should be, it can kill the person with COVID. Remember that it is not immune system's failure that a cytokine storm occurs. It is immune system's failure by overactivity. So if somebody says that my immune system is quite overactive and quite robust, they could actually end up in an immune system really causing damage. So protection in whatever way is important. I think so. So Jennifer, I agree with you. We have done this discussion many times. Jennifer, I remember I had taken this as a uh, task, but I just spent this weekend. So I had been so much under stress because of some not so cool beans continuously, uh, sending complaints and creating legal issues, that I was just not very well oriented. So this weekend, I just spent time with my family and we just enjoyed. We went out. I did not do much research. My apologies, but I would do it. Genesis Light says, are there any other ways to boost your antibody production without getting booster or getting reinfected? No. So I want to answer this question with the mechanism for why there is no other way. And of course, infection is not a correct way. So this is a question I was hoping that in last 18 months at some point somebody would ask. So you haven't asked a direct question, but in this question I can answer with this mechanism. Imagine here we have a B cell. This B cell is a memory B cell, or it may even be a not memory B cell. It is aware of how to work with the SARS-CoV-2 spike protein, meaning it has a B cell receptor, BCR. B cell receptors are actually immunoglobulin D. So for the healthcare students here, when I meet you, remember this, I'll ask you this question. What is a B cell receptor? B cell receptor is actually immunoglobulin D. IgD acts as a B cell receptor. So here is a B cell receptor. B cell receptor, let's say this B cell knows how to connect with SARS-CoV-2 and how to make antibodies against SARS-CoV-2. Here is, let's make one more B cell here. This is another B cell. This B cell, let's say, is a little different, and it knows how to connect with, let's say, flu virus, and how to be, how to take care of the flu virus. And then there is another B cell. I just want to make some B cells. This B cell is, let's say, able to connect with something else. Let's say common cold, rhinovirus. Right? Now the question is it possible for us to activate these B cells without getting infection or without getting the vaccine? Here is a problem. Let's say we put some cytokines here. The cytokines are the ones that helps activate the cells, that are one part of the activation. So let's say we say interleukin 4 and 5. Interleukin 4, interleukin 5. These interleukins can cause B cells to become increased in number and differentiate. They can cause proliferation and differentiation. So you say, you know what? Forget about the vaccines and forget about the infection. Let's just give interleukin 4 and 5 to the person, and that would go and work on the B cells, and that would increase their differentiation and proliferation, and voila, we have a solution. Here is the delicate point that we have not discussed throughout 18 months. Only those B cells that have actively connected with the pathogen will become active when cytokine is given or spilled on them or poured on them. So look at me for a second. Imagine I'm a B cell. I'm standing here. My receptors are able to work with the SARS-CoV-2, but there is no SARS-CoV-2 attached to me. I am not bound to any SARS-CoV-2. I'm just standing here. If I'm standing here, You can pour as much cytokine on me as you like, and I will not become active. But if you have a SARS-CoV-2 standing next to me and I hold it, then I'm ready. If you now pour the cytokine on me and this receptor is engaged, then I know that you're giving me an order to attack this thing. Then I'll become active. This is called co-stimulation. This is a protective mechanism in our body. Otherwise, anytime an infection occurs, anytime cytokines are produced, every cell in the immune system will become active. We will be destroyed by our immune system. So our immune system cells only become activated when they have actively engaged with the enemy. Then you give them an order to say attack, and they'll attack. But if the soldier is just standing there and you say attack, it's not going to do anything. This is a very important concept. So now if I go back to your question, Genesis Lights, if we say, are there any other ways to boost your antibody production without getting booster to get or reinfection? So what we are saying is this. We are saying, or you are saying, can I have this B cell of mine, which knows how to work with the SARS-CoV-2, to just become active and make more B cells of its kind and make antibodies from it? And the answer is no, until it is attached with an antigen. What does a vaccine really do? There are so many myths and rumors, and basically vaccine is just offering that antigen. It's saying, here is an antigen that looks like the virus. It's going to go and attach with this B cell. And when it is attached, we are going to send a bunch of cytokine on it. This B cell would make copies of it, and it would make antibodies, and it would get trained, and it would make memory cells, and they would all go and sit together. And then in the future, when the actual virus comes in, they would attack it. So that co-stimulation, if I go here for a second, co-stimulation for the, I'm so sorry for the immune cells. I'm so sorry for the noises. So if you see here, if you pick up any one of them, again, I want to be mindful of the copyright for the people. But if you see here, this is antigen presenting cell. For example, it could be a macrophage or a dendritic cell. B cell too, but mostly they don't present like this. Here is a T cell. This is MSC1 or 2. This is another co-stimulatory thing. Then there would be cytokines poured on them. So there are double check and triple check before a cell becomes active. So that is how it works. Very good question. Flowers in her hair says your drawings are much cuter. Thank you very much. Drawings is why I do these educational discussions. Genesis says, thank you, you're a rockstar. You're very welcome. Very good question, though. Soma and Sijoy Ghosh says, can AstraZeneca, second dose taken without any hesitation if first dose caused only common side effects like fever, headaches, and myalgia? So any adverse? That's a loaded question, Soma. The reason for that is, number one, I cannot advise you or anyone here. It's more of an educational forum. And then everybody's body is different. So one person's body cannot be generalized to say, this person responded this way, then this person should respond that way as well. So there's a majority that responds better, but this is something that you should talk with your doctor. They should know your allergies history. They should see what was your last time when the first dose was taken, what were the kind of side effects you had, how long did they go on, are there any lingering side effects still now? Then they should talk about how to move forward with the second dose. I wish there was some test to say first dose did this and second dose will be bad or good. There is no such test. Emily Wiggin says, any thoughts on the recent paper showing residual CoV-2 viral antigens in GIT and hepatic tissue? Lots of talk now comparing long COVID to feline coronavirus and HIV in that it persists. Emily, very good question. A few weeks ago or days ago, Dr. Paul Marik, we sometimes communicate over the email as well. So there were a number of researchers, and Dr. Paul Marik was there, and he was talking about their paper about viral shedding through the GIT system, fecal matter, and the dysregulation of microbiota or the normal flora, and the association of that with the severe COVID. That's a very important paper. The thought was, and I hope I'm not stealing his thunder, the thought was that microbiota and its correct environment is very important for less severe outcomes. I had done a discussion of a study from China. I did that last April-May timeframe, in which they observed that viral particles, not viable particles or viral pieces, continue to shed for 59 days after the infection recovery. Not during the infection, but after recovery, another 59 days is where the fecal matter still contains pieces of the virus. They are coming from somewhere. They are coming from the GIT cells. Then there was another study that I had discussed, which was viral presence in the GIT cells causes affinity maturation of the immune system and improves the outcome of a person. So I had discussed that as well. Affinity maturation is, imagine if I'm a B cell. So today is my B cell day. If I'm a B cell and I am going to attach with a virus, what happens is in the beginning when I'll attach loosely. And then when I continue to be exposed to this antigen, I keep refining my genetic material that is making my receptors to attach here. Plus, inside the lymph nodes, there are cells called follicular dendritic cells. I call them lover cells. They always have a flower in their hand for B cells, the flower being the antigen. So follicular dendritic cells, they pick up the antigens and bring them near the B cells and give the B cell a chance to practice on the antigen and become more and more mature. That process is called affinity maturation. The study had said that the virus's presence in the GIT helps the cells to do affinity maturation, and body's immune system actually becomes better with the virus present in the GIT. So this is the things that I've seen so far. The question that does the viable virus still stay in GIT after the symptoms are over, that still needs to be proved. So if there are any studies, I would definitely look into them. Rima says that study was fascinating. Yes. Emily says, fascinating. You're very welcome. Jody says, prophylactic higher dose twice a week now for hotspots or high risk. Yes. So at the same time, I also feel that, for example, when I look at some of these folks whose cases I presented today, in a lot of cases, the symptom set is changing, at least for the, I would say, previously infected and for the vaccinated. P. Lee J says, so no remdesivir for patients on beta blockers, especially women. So, of course, remdesivir can cause this side effect. So, I think what would have to happen is that the doctors would have to assess that the beta blockers that are being given, their effect, if combined with remdesivir, what is the possible outcome? And in terms of pros and cons, imagine if remdesivir is useful and then is not given because of the fear, maybe beta blockers can be stopped for a few days because the fear of cardiac toxicity, and then the patient succumbs to death, that would be a problem. So I think this is where the doctors come in and they figure out what should be done, which drug should be reduced, removed, which drug should be given. Carlos says, does aspirin reduce vaccine efficacy? I don't think so. And the reason, the way I would say it, again, not an advice for anyone, I'm talking just from an educational point of view. When I went for my vaccination, actually not my wife's vaccination, somehow at that time it was newly started and they allowed me there as well. And the nurse asked her that, have you been taking any medicines? And she said, I've been taking following over medicines. And the nurse said, any over-the-counter medicine is okay, you can take them. So that's how they have been trained to look at. So aspirin is one of the over-the-counter. Nature Fan says, people hit the like button. 455 watching, only 80 like. Come on, guys, do your part. Yes. So Robert says, you can look and see the health department is using data from, definitely. So fecal shedding of the virus is a thing. So when the person becomes infected, they start shedding in the fecal matter, and they continue to shed 59 days after their recovery. So that means if a community's fecal material generally shows the virus particles, then that means there is infection in that community. That's actually a very smart way to check it out. It has been done for other pathogens too. Dr. Pramod Kumar says, now 120. Thank you very much. Shan says, I don't think it's a question. Since nitric oxide, or it's a question for me, unless you're asking that to me. Since nitric oxide can be a spike protein blocker, has anyone considered taking a Viagra a day? Is it a spike protein blocker? Asking for a friend. So if the questions are usually directed at me, so if you're asking me about Viagra, Dr. Pramod Kumar says, third booster shot are in development by many companies. What's your view on that, sir? By the way, I was meaning to say you are means architect, and how's Luffy? So Luffy is doing good. He is right now upstairs. Kyrie is sitting over there trying to sleep, but I'm continuously talking, so I am an interruption for her. Now, booster doses. So we saw vaccines booster in Israel. That seemed to have a lots of positive effect. So I would hope that their boosters include addressing the latest variants instead of just previous vaccines booster. So Gigi says lufimectin and sperm related issues, long lasting or only while taking, dangerous only in mice, not humans. Good one. So you looked at that study as well. So albino rats was a study on ivermectin showed reduction in sperm count, and they said just use antioxidants to reduce the reactive oxygen species and it is fine. So they had said if I recall correctly, vitamin E to be used. So that's how it is. And yes, once the lufimectin is stopped or removed, yeah, the sperm count will go back to normal. And this is still only seen in rats, not humans. Carlos says, do you think there is any harm theoretically while asking the nurse to aspirate before she injects the COVID vaccine? No harm. Ideally, again, in theory, if you ask for aspiration, that would only do further safety check. Patricia says, anything new on Novavax? Is it working in the countries that are using it? I'm still waiting for Novavax unless equally better vaccine comes along. You are the best. So number one, thank you very much. Number two, please don't wait so long. Just take something. Having said that, I have not seen yet any further progress on Novavax. This is my opinion part. I may be wrong. I think Novavax is not going to become approved here in the US because there are ample vaccines already and there are less takers. I think there is less thought, and maybe again I may be wrong. I think there is less thought in administration's point of view to say maybe people don't want this vaccination. Maybe if we offer Novavax, they would take it. I don't think that they're thinking that way. So I don't know how Novavax will become approved. That's sad, but that's how I think it is. But that's just my thought. Genesis Light says, I'll be okay with mandated Viagra. I had a joke in my mind. Okay, so Soma says, can COVID induce or accelerate cancer? Seen one family member get cancer within 2.5 months and he had completely no symptoms, just nothing. I haven't yet seen any study. There are some viruses that are related to cancers, but over a long period of time. I haven't seen any studies that says it. So as far as my knowledge is concerned, I don't think so. There may be some studies I'll have to research. I haven't yet heard this. Here is Luffy. Hey, Luffy. What's going on? Come on here. Luffy, what happened? Luffy. So it is funny sometimes people put a comment that you're a weird person, you talk with cats. Somebody had put a comment that stop talking with cats. I love talking with cats. Hey Luffy, where are you? Come back. He went away. Luffy. I'm going to try to bring him. Give me a second. Lights bothering you? That was Luffy. Cool. So how about we break for today? It's almost 8 o'clock and we would see each other again. So thank you very much for your time and for being with me here. Please like, subscribe, and share. And if you wanted to support this work, there are some links in the description that you can use. And I would see you tomorrow. Bye-bye.